After he tested positive, he did extremely well. He went, they say about if you can make it through 14 days, you've made it. He made it through 10 with absolutely no symptoms. And I'm like, yeah, he's going to do this. He is going to beat it. And just a day or two later, they told me that he had spiked a fever and his oxygen levels were down. And I knew then that he wasn't going to beat it. He definitely was going to be in tough, right? I didn't know it would be as bad as it was, but I knew the potential was there. It really didn't take too long. Your body kind of shuts down. He quit eating, he quit drinking, he just slept all the time. They had the oxygen tubes like in the nose, first of all, but that wasn't enough. It wasn't able to keep up. It wasn't able to keep his oxygen levels up. So then they had to go to the mask. And he just slipped away. He wasn't in pain, he wasn't gasping for breath, but he just shut down. And they told me that I couldn't go near him, which I wasn't quite prepared for that. I thought if I could see him, I could like touch him, but no, I couldn't. But I could stand, at the edge of his bed and tell him how much I loved him. Tell him, recite all of his children's names to him and say, we all love you so much. You've been the best dad ever. And, Dad, if you're tired, that's okay. You've raised us well and everybody's good and it's okay. And, I knew then that it would be the last time. And I just feel like he heard me. He didn't open his eyes, but I feel like he heard me. And within 24 hours, he slipped away. As soon as I got the notification that it was there, I immediately sent my concerns to the administration there and to the Ministry of Health and said, this is going to be really scary. This is going to be really challenging because how are we going to isolate these people? What's the plan? I believe that when this individual went off-site to acute care and returned, they should have been isolated. And it may not have spread at all. So, but again, once it got in there, that certainly was a problem because all they could do is sort of one-on-one to keep people apart, right? And they for sure don't have staff to do that. I think that this experience has been sadly the best thing to teach us lessons, right? Learn from the things that didn't go well the first time and to make those into policies and procedures so that they exist for whatever pandemic might come along. And I don't think we're out of the woods. I think there's always going to be something that's going to come along. And but I think that there needs to be more funding in healthcare in general, but certainly in long-term care facilities, because we've been told all the time that we've got an aging population, and pretty soon that's going to be me in long-term care. And so, there just needs to be more and more funding, I think.